my diet became under a microscope a little bit, so I switched to excessive exercising. So you see, all obsessive related types of things. So finally, when I went into medical school became the perfect distraction because all I could do was obsessively do something, which was study, right? And I wouldn't be surprised if many people in medical school have either anxiety, depression, OCD, one of these types of things too. So having a background history of what now I would come to know as pure obsessional OCD, which is I didn't have the compulsions, I wasn't washing my hands, I wasn't checking locks, I wasn't doing anything of that sort. It was all up here. Pure OCD is a subtype of OCD, much less common, but that is the most favorable type of OCD in the postpartum period. So if you have a pre-existing history and you go and have a baby, very much likely you're going to have postpartum OCD. But I did what every doctor does and thought, perfect, I'm going to ignore it because that's what I thought was best. So in medical school was when I figured out, like 20 years later, a psychiatrist was giving us a lecture, and on an asterisk, like below the slide in very tiny letters, was subtype of OCD, pure OCD. So I called my fiance and I'm like, I think this is it. Like, I think this is what I have. Up until that point, and up until my mid-20s, I just kind of shelled off that part of my life and directed all of my attention to studying, focusing, being the best, being the best. And then I had to go through my psychiatry rotation, and I'll never forget, there was two patients, one with pure OCD and one with bipolar. I gave the chart of the OCD to my friend, and I said, you go see her. I'm going to go see the bipolar patient because I couldn't come. It was too close to home. Mm-hmm. And yeah, with the birth of my first son, it wasn't just a reconciling of the diagnosis. It was a reconciling of my entire life and what had led up to that point. So when I say I hit rock bottom, I truly mean that in all senses of the word.